Hai, saya Dr. Sofia di acara SILC Lasik TV. Saat ini saya bersama Dr. Sahwan di Barcelona, Spanyol. Dan saya sedang bersama Dr. Sahwan, suatu dokter mata dari Dubai yang sangat terkenal, dan alhamdulillah saya mendapat kesempatan untuk menginterview beliau dan untuk para sahabat SILC Lasik Center dan seluruh mungkin para kolega yang ingin mendengarkan, silakan. Dan ini luar biasa banget, kesempatan yang sangat jarang bisa saya dapatkan. Hi Dr. Sahwan, I'm Dr. Sofia from Indonesia. I want to ask you some questions. The first question, how about your opinion about LASIK surgery? Because some opinions said that the LASIK surgery is cosmetic surgery, but some opinion they thought that the therapy procedure.
Yeah.
Which one is your opinion?
Well, we cannot consider that the LASIK surgery as a therapeutic unless we know that those patients that they have a high refractive error, they are not willing to use their glasses now. So what they will use? They will use contact lens.
Yeah.
And that have a higher risk than LASIK. So when you are asking them why you are using contact lens, well, I'm using it because most of the population, they are using contact lens. But this is not the truth. Contact lens has a high risk of infection, of dry eye, of, let us say it from the beginning, dry eye first, and thinning of the corneal thickness, and then infection. Now, if you all remember, when we are studying when we are resident in the ophthalmology, what's the meaning of acanthamoeba?
Yeah.
Acanthamoeba is a serious.
Yes.
And I'm asking my patient, for example, especially those that they are saying, well, we cannot do the LASIK because LASIK is a cosmetic and we don't need to do it. I said, okay, so why you are not wearing glasses? He said, no, because I'm wearing contact lens. Do you know the risk of contact lens? No, there's no risk. The opticians told me that there is no risk behind the contact lens. But that's not true.
Yes, that's right.
So when you compare between the risk factor of the LASIK per se and not other type of the refractive error and the contact lens, you can find that the LASIK complicates much less than the contact lens. So safely, if they need to be on a safe side, okay, glasses. But they are not willing to use the glasses.
Yeah.
Because our life starts to be more complicated than you can use glasses everywhere.
Okay.
She need to, or he need to do a sports. He or she using the laptop, table, tablet, morning, traveling. That glasses is definitely disabling. So what I'm saying is that it's not the LASIK is not a therapeutic, but it's needed this time. So, and it's much better than contact lens if they decide to go to the contact.
Yeah. And also there's medical indication if the refraction is between the both eyes.
For sure,
and
that when we are saying that there is an anisometropia or anisometropia, what we mean that there is a high difference in refractive error. Patient with, like for example, -7 with -2 and 100% in -7 have some sort of amblyopia, but they are not willing to use the glasses because when they are using glasses, the difference should be less than 3, as you know.
Yes.
And that's why they are not using. So they are not using the eye. That's why we are doing it.
Yes.
But in my expectation and in my understanding now, most of the patients, they are Googling everything and they are whatever you are telling them, they are Googling. So they know all the details from the Google. Hopefully that this information is right in a way that when they are Googling it, it's giving them the right issue.
Okay, okay. And the second question.
Yeah.
And from all of the technique laser vision correction,
Yeah.
which one the technique the most wanted from all your patients?
Well, I was answering one interview that I was talking to one of the team of Schwint, asking him why we are not progressing to go through the second step. He said, "Why you are in hurry?" I said, "I'm not in hurry. My patient, they are in hurry." Till now, we are treating the myopia and myopic astigmatism. And we need to enter ourselves into the simple astigmatism, means the zero and astigmatism. And we need to go through treating hyperopic astigmatism, which is a mixed astigmatism. We need to go through it. Why? Because we have a higher population comparing to the hyperopia. So hyperopia, we have lower. And it's not considering more than 2 or 3% of our work. So we will progress because the demand of the patient progress.
Okay.
When the patient seeing that when you are doing smile or lenticular extraction for them, and second day, he's free or she free, she can use the makeup, she can swim because there is no cut.
Oh, the second day.
Second day.
Oh, it's very fast.
And they can travel, they can. And one case that I have, he's in the military. So he has -5. Okay? So he went to the military. They told him that you are not fit. You need to go to do a refractive surgery. So they know that he has -5. He's supposed to do Lasik or laser or whatever. He came to me, we did smile. He returned back to that doctor, same doctor. So he saw him, he saw ±0.25, ±0.25. So he checked the eye just to see which kind of procedure that he did. That was 2 weeks after the surgery. Then he didn't realize that there is nothing. He said that he asked him, and his mother was with him. And his mother, fortunately, I'm entering all the relatives with me in the theater. So they can watch, they can see the surgery. So he asked the mother, did he do any surgery? Is there any contact lens? She said, no, he did surgery. My dear, where is the surgery? Well, there is no any cut. There is no any sign of laser. Where is this? She said, what, doctor? This is the movie.
Yeah.
Then he realized this is a smile. So he called me directly. Sorry, Dr. Safwan. I didn't realize that the smile cannot leave a trace, or the lenticle cannot leave a trace, especially if the cup is clear and there is no any haze and there is nothing to demarcate, and the size of the cut was a transitional like our lenticle, and it's not leaving any trace. You cannot see it. Me, I'm the surgeon. He did the surgery.
Yeah.
And so I said, well, yeah, okay, this is the margin. Oh, no. Okay. At this area, I was struggling, but there is nothing. So that's why. When those people, because they are so smart, you know, all our people, they are now very smart. They know everything. They are asking everything. So when they are asking their colleagues, their relatives that they did the surgery, what did it? I just passed 15 minutes. I slept. Second day, I came to him. I removed the bandage contact lens. And then that's all. I was studying, flying, doing nothing. That you are using drops? Yeah, I used it for 1 month. And then now sometimes I'm using the artificial tear.
And for the swimming, how long?
Well, for me, I'm asking them for after 1 week. They can swim. Yeah.
Oh.
But for LASIK, no. 30 days.
Oh, yes.
For laser, 30 days.
Yeah. So you can say that the most wanted the patient of your patient want to be a lenticular extraction.
Yeah, lenticular extraction. They know it as a smile. So there is a trademark in our name, New Vision Eye Center. Smart Smile.
Oh, smart.
Smart Smile. It's in our trademark in Dubai.
Very unique in your Dr. Sahwan, this the last question. Maybe you can ask. Maybe you can tell all the sahabat SILC Center how long you have experience in LASIK surgery, and also maybe you can give some advice for the people who watching us from your opinion.
See, for me, I start 2000 refractive 2003. And then progress and I start with the Bosch and Long first, and then with the wave light, and then with the Schwint, during which I was doing also for other surgeons in Zeiss company. So a long story. It's around 21 years or 22 years as a refractive.
Yes.
But as an ophthalmologist, I'm 30 years.
30 years.
But I'm still young, huh? Yeah. So my advice to the medical staff that they need to be in the ophthalmology. Ophthalmology is not a branch that we like to be in, but we don't have the passion to to go in. It's a difficult, complicated. It needs passionate doctors that they love their job, so they can withstand patient demand and satisfaction levels very high. Sometimes you cannot reach this satisfaction level. So sometimes the patient saying, you are asking a lot of questions. I said, see, I need to reach to which level your satisfaction, where you reach, what you need, in a way that I can see whether I can reach with you to that satisfaction level or no. I can. So it's a challenge.
Yes.
High tension for a doctor. For our patient, for sure, our patient, they need the highest technology, the best expert hand, the best visual recovery, the shortest the time of the visual recovery.
Yeah.
Like the patient that he come to me and he's 75. See, I need to see distance 6/6, near 6/6, intermediate 6/6. I don't need any night halos. I said, when I checked your eyes, you have a diabetic. You have diabetic retinopathy. You have diabetic changes. You have a diabetic optic neuropathy. So, sorry, I'm a simple guy. I'm a very simple doctor. I can do cataract extraction, but I cannot reach your visit.
Yeah.
Did anyone tell you that? They said, no, I came to Dr. Safwan. I said, Dr. Safwan is a simple guy. Poor slave of our God. I'm very simple guy. You can't reach to this.
Yeah.
This satisfaction or this high satisfaction
Yes.
level, the standard that you need to reach, it's
Yeah.
not for you.
Yes.
It's not for you.
Yes.
Even when those patients that they are coming in 45 or I need this, I need that. I don't need to do cataract. I don't need to do Lasik, but I said, what we can do? I don't, give me a drop. They said there is a drops that makes you feel that you are in 25. I said, but 25 does not mean that you are healthy. a lot of people in 25 they are wearing glasses. They are using drops.
Yeah.
They are severe dry eye. So it's not a target. Anyway, this is our life. We need to adjust it. And that doctor, he needs to be the social doctor, ophthalmologist, psychiatrist.
Oh, yeah,
Because
because
the patient
yes.
coming and he
Yeah.
don't know.
Yes.
He know that
That's
you
right.
are the target
Hmm.
that will save his problem.